Okay, hello guys. This is Thomas Gam from Slatina Pitch. So today we will see the admission criteria of pneumonia in the pediatric age groups. I hope this is easily rememberable and understandable mnemonic for admission criteria, and we can easily use the admission criteria by using the name pneumonia itself. So let's go and see each letters. So when we come to the first, the P, which tells about the first criteria for the admission, which means the presentation of the patient. The presentation of patient. For example, if the patient have toxic appearances while in the OPD, we have to admit the patient in treating us like inpatient. So the first criteria for the admission is the presentation of the patient. N, which stand about no hydration. Okay, no hydration, which means in the other name dehydration. Okay, if the child is dehydrated, and if we see if we got any sign and symptom of dehydrations, like altered mental status, if there is irritability, and also we have to see the thirst, if the patient is drinking or not, and also we have to skin pinch, and also we have to see the eyeballs which is sunken or not. So if the patient, if we got two or more criteria for this, and if suspecting dehydration, so we have to admit that child and treated inpatient. The E, which stand for effusion. Okay, this is the one complication of the pneumonia. So if we find any complication of pneumonias in that child, any symptom and sign of complication, we have to admit that patient also and treat inpatiently. Okay, U, which stand for underlying condition. Underlying condition, which means if the patient have like other underlying condition, for example RVI, if the patient is RVI positive, for example HIV, and also if the patient is TB patient, so if there is any other any underlying condition, so we have to admit and treat the patient. Okay, the M, which stand for moderate. Okay, moderate to severe malnutrition. Okay, moderate to severe malnutrition. If the patient, if we find any sign, symptom, and any history important which clues us malnutrition, so we have to admit and treat that patients. O, okay, O means outpatient. Okay, outpatient, which stand for if the patient is unresponding for the outpatient therapy, for example amoxicillin, okay, the national guideline. Okay, so we have to admit the patient who is not responding for the outpatient treatment. N, which stand for easily for the remembrance, the sake of remembering, 90. Okay, number 90. If the patient's oxygen pulse oxygen if the patient saturation, if the child saturation is less than 90, okay, in that case also we have to admit that patient. In addition to the desaturation, if the patient also have respiratory distress signs and symptoms, for example grunting, nasal flaring, and also using of accessory muscles like intercostal and subcostal muscles, so in that case we have to admit the patient and treat accordingly. I stand for inability to feed. Okay, inability to feed. Okay, inability to feed, for example if the patient is unable to feed the or sucking the breasts or breast milks, in that case you have to admit and also treat the patient accordingly. The last mnemonics, which stand for A for admission criteria of pneumonia, is, what is that? Age. Okay, age. If the child is less than 6 months, you have to admit and treat the patient accordingly. So this is a easily remember mnemonic for mnemonic for the admission criteria of the pneumonias, like by its own names, pneumonia. Okay, you can easily remember pneumonia. P, which stand for the presence of the patient if toxic. N stand for no hydration, which means dehydration. E stand for any complication like effusion. U stand for any underlying condition like HIVs, and M stand for moderate to severe malnutrition. We have to admit the patient also. O, which stand for the outpatient treatment failures. N stand for less than 90, which means 90 plus respiratory distress. We have to admit the patient also. I, which stand for inability to feed. Okay, and the last A, which stand for age. If the child is less than 6 months, we have to admit and treat that patient accordingly. This is the mnemonics for pneumonias. I hope you will be benefited from these videos. If you like and subscribe our channels, and we will update you with other easily memorable mnemonics in other time. Thank you guys.